So if your doctor has talked to you about apnea, that means that you stop breathing for at least 10 seconds or more, followed by an oxygen drop at night. And the hard part in understanding why that's so impacting is, one, you're asleep. So it's almost impossible to be aware of what's going on while you're sleeping. But the other thing is, why is 10 seconds so important? I mean, we could all hold our breath for 10 seconds. If I counted down from 10 right now, you could hold your breath for 10 seconds and not really feel anything. Why don't we do that together? So take a deep breath, hold it for 10 seconds. Okay, so it didn't really feel like much, right? It didn't for me. I'm sure it didn't for you. But you see, apnea, obstructive sleep apnea, actually happens at a point called P critical in our respiration. That means in our breathing pattern, when we breathe out and in, out and in, there's a slight pause when you breathe in. Let's do it together. And then a slightly longer pause at the end of our exhale. You see, that's the point where most apnea actually occurs. So let's do a slightly different exercise together and see how this feels. So I want you to go ahead and breathe with me through your nose or your mouth, whatever's comfortable. Take a deep breath in and out. And in and out. Stop. I want you to hold it for as long as you can. Take a look at the second hand on your watch or start your stopwatch on your phone. How long can you go? 10 seconds. 15. 20. Are you still going? See if you can wait all the way to 30. 25. 30. Okay, breathe in. Take that breath. How'd you feel? Did you feel a little tightness in your chest? Possibly your heart start racing a little bit? You see, the difference in that first exercise of holding your breath for 10 seconds versus what we just did together isn't just how long we held it, but it's at what point in our breathing pattern did we hold it. You see, when we take a deep breath in and hold our breath like normal, jumping into a pool or doing that first exercise, 10 seconds really is not that bad. We have plenty of oxygen to go around from the pool that exists in our lungs. However, if you breathe all of that oxygen out in your breath pattern and then you hold your breath, we can obviously feel the difference in how that affects our body. So if you think about apnea from that standpoint, know that when you're taking that deep breath in, that's what your body so desperately wants in that oxygen. But if you're having an apneic event at night and how many times you have it per hour, that can really add up 10 seconds at a time. That, my friend, is how we understand what apnea is doing to our body and why 10 seconds matters.